An estimated 35 million men experience male pattern baldness here in the U.S. Yet, there's still a huge amount of misinformation out there about this condition. Dr. Richard Chaffoo is here to help us debunk some of those myths. Doctor, good morning. Thanks for joining us.
Good morning, Raoul. Good to see you. My pleasure.
Okay, so this first myth that we're going to bring up, this one is the one that I think most people use. My mom's dad had a full head of hair, so you know what? I'm fine. It's my mom's dad that Is that true?
You know, Raoul, we used to think that. Hair loss was on the female gene, but actually what we found is that it can be on both sides of the family, or it can be on neither side of the family. There are literally probably a couple of areas on our chromosome that are responsible for hair loss, and so it's a more complicated issue. Certainly, you know, you can't, if you're, say, your maternal grandfather had hair loss, you're probably at a higher risk to have it, but because either or none of your family members have hair loss is not necessarily going to get you out of the woods.
Yeah, my grandfather on my mother's side went bald in his 20s. Good-looking man, but
your hair's looking pretty good, though.
And then look, so that myth was out the window for me.
Exactly.
Okay, let's get to myth number 2. Male pattern baldness only affects older men.
Yeah, I wish that were the case, Raoul. You know, in my practice, I see a lot of hair restoration patients or patients for hair loss, and unfortunately, a significant number of young men, and these are men that in their like the late teens and early 20s, I know, are developing hair loss. Of course, it's very stressful, as you can imagine, for a young man to have that type of loss, and unfortunately, the earlier that you begin to develop hair loss, probably the more extensive it's going to be, which is sort of intuitive because you're all around the planet longer. You know, this issue of our DHT susceptible follicles, there's more likelihood to damage those follicles and end up with a more progressive loss. The earlier in life that you get, if you get your hair loss, say at my age, it's not such a big deal. You're probably not going to have such an aggressive form of hair loss.
Seems like everybody's got a connection to all of these myths, because I remember I was a junior in high school and there was a kid I knew who was thinning so much and you could see that he was going bald at 16 or 17 years old.
Yeah, exactly. And we'll see that. I'll see people, young people like that, unfortunately, so it can be very stressful.
Okay, myth number 3. This one I had never heard of. Veganism causes hair loss. Is that a thing?
You know, it's not so much a thing. You know, what I would say is, you know, certainly there are causes of hair loss that are medical causes. So, for example, there's something called shock loss, or telogen effluvium is the medical term. And if you are malnourished, if you have a stress in your life, say you've had an illness, we've talked about this before on the show regarding COVID, there can be medical causes for hair loss, but veganism in and of itself may not necessarily be a factor because you can obtain your protein from other sources.
Myth number 4. I wear baseball caps every day, so this, my hat is starving my hair of oxygen. Is that even possible, doctor?
Yeah, I wish it was that simple. Yeah, I mean, unfortunately, hair loss, there is much more that is unknown about hair loss than is known, Raoul. And so we think that there may be some issues with microcirculation or diminished microcirculation, but certainly wearing a hat is really not going to affect your circulation to your scalp, is not going to cause more progressive loss. Probably the reason why a lot of guys are wearing bald caps is because, you know, nearly half the men by the age of 50 will have some hair loss, and it's a quick and simple way to, you know, to cover the bald area. So it's not really a direct relation or correlation between that. And I tell my patients that all the time. Don't worry about the type of hat you wear. Now, there are certain conditions where, for example, certain professions like ballerinas or the people that wear their hair very tight in the back, like even man buns, you'll get what's called a traction alopecia. So you can actually get thinning of the scalp on the sides because you're pulling on the hairs and you're stressing out the follicles. And when you release that pressure, you can get hair regrowth. But bald caps or even tight-fitting caps on their own are probably not going to have any significant effect on someone's hair loss.
That might be the most important thing we mentioned today. Hey, guys, quit the man buns. It's not good for you. Just no more man buns.
Exactly.
Just quit the man bun. Okay, so here's how we're going to encapsulate all of this. If you're worried about this hair loss, What should you do now? And especially since we brought up it happens in younger people, it happens in older people. What do we do now?
It does. So, I mean, I think one of the best things, Raoul, is do your research. You know, I always tell patients that knowledge is power. Unfortunately, there's a lot of information, but also disinformation or misinformation on the web. You know, I wrote a book actually last year, and it's available on Amazon. And I wrote this book because I wanted people to know about hair loss and to know about the science. You know, it's so sort of evidence-based book, and it's sort of like the Cliff Notes on hair loss. So it's an easy resource to look for. There are a number of professional societies: the American Society of Plastic Surgeons, American Academy of Dermatology. All of these are organizations, medical organizations, where you can gain information. American Hair Loss Association. There are several of these organizations where you can get more information, but again, you want to really do your research and ask a lot of questions and make sure you're not falling into the myths that we just talked about.
Dr. Richard Chaffoo, great information as always. We appreciate it.
My pleasure. Good to see you, Raoul.
Good to see you.